Right, consultants in England have begun a 2-day strike as part of their ongoing dispute with the government over pay. The British Medical Association also announced plans for 3 more days of walkouts on the 2nd, 3rd and 4th of October, which coincidentally is during the Conservative Party conference.
Will that make a difference? Right. Some people will sympathise with what the doctors are asking for, and others will be saying this is selfish and dangerous to go on strike. Those are people who are obviously never sick, never need medical help, and hopefully won't need it. Joining us to debate this, Patrick O'Flynn. Patrick's a political commentator and a former MEP. He thinks doctors are already very well paid and they should thank their lucky stars. Here's Dr. Ahmed Hankir. He's a consultant psychiatrist, and you, doctor, you want to see a pay increase for doctors. State your case. Why?
Well, good morning, everyone. So it's not just me. I think there are many others. And I think for a very long time we have been discontent. We have resorted to industrial action. It's not something that we do with pleasure, and we do it with a heavy heart. But I think we're demanding for pay restoration, and we just want to be paid fairly. And we just don't think that the current remuneration reflects all the hard work and the sacrifices and the suffering, years and years and years. It was like I've been to hell and back with my training and through medical school.
Let me ask you this, Doctor. When you were picking up your GCSE results those years ago, and you probably already had your eye on medicine, that's what you were heading towards.
Absolutely. Yeah, I've always wanted to be a doctor. Yeah, I always wanted to help people.
Did you? What was your thinking, or if you could tell the young Ahmed now what his career ended up like, what would you tell him? I mean, do you think you've been shortchanged in terms of what was expected of you?
Well, I think I would. I mean, I was quite the idealist back then. So, I really wanted to help and heal and maybe even save the world. And it's my dream. I am living the dream. And but I think I want to perhaps be more realistic. I want to be a realist as well. And we are living in the real world, and doctors are human beings. We have families, we have people who are dependent on us and financially reliant on us, and there's cost of living crisis. And you come out of medical school, you end your training, and you're up to your eyeballs in debt. And so, I think to answer your question, continue to serve society and to have those ideals, but to be realistic as well.
At what price serving society? What is the average price of a... you don't have to tell me what you're earning, but, someone qualified at your age or stage, or what is the issue? What sort of ballpark money figure are we talking about that you get?
Well, I think it depends on the number of years of experience that you have.
Yeah, but people are going to be phoning in today and they're going to say they get,
So Steve Barclay has said the average NHS earnings for consultants is £134,000. They say that they get generous tax changes, which entice them to stay in as long as possible, and £78,000 a year once they retire. Patrick O'Flynn, you think they're being greedy?
I do in this instance, and I must say the caller in who said I've never seen a poor doctor, well, I disagree with that, because I don't think we should want to see a poor doctor. If we had poor doctors, we'd be in big trouble as a society. But we don't, £134,000 plus the biggest thing the British Medical Association wanted from ministers was removal of the cap of the lifetime pensions, and they got that. And as far as I'm aware, this 6% pay offer is generated from an independent review body. They're getting that. I can't help worrying the BMA, not just the consultants, the junior doctor section 2 is becoming explicitly political. I think they're trying to leverage the fact that one of Rishi Sunak's top 5 promises is to reduce waiting lists and times.
Well,
and
they're also falling out with Labour, and I think they're on course to have a fallout. So you can't particularly...
Well, I think they know that Rishi Sunak can't get the overall waiting lists and times down if various grades of hospital doctors are going on strike every few weeks. And, of course, we want doctors who are exceptional people doing exceptional things to be well paid, but we have an overall economic context. We've been through COVID. The economy hasn't grown much for a while and isn't going for a while.
Should he be paid more than you?
Yes, and I'm quite sure that Ahmed is paid more than me, without going into figures.
I wonder how you reconcile, as someone who will have declared a Hippocratic oath and committed, as you said at the very beginning, you knew you wanted to help people. How you will reconcile the next 48 hours or so, the further strikes in the autumn, when we know that there is nobody who can step into the shoes of consultants. Consultants kindly stepped into the shoes of junior doctors whilst they were striking. There will be crises, emergencies, life-threatening situations in the next 48 hours that will cause harm to patients because consultants like you are not turning up for work.
Well, I mean, strictly speaking, I will be turning up for work because I'm working as a locum consultant. And we know that emergency services will have 24-hour care. So I just want to really emphasise...
And paid very well for that, handsomely. And you also do private work. So it sort of undermines the argument that you feel like you're not being paid particularly.
They're not paid very well, not for the hours that they put in.
Well.
And not for, I mean, when you compare it to how society grades celebrity, for instance, how they create or rate the creation of wealth in the city or whatever it happens
But they're
to be.
paid for differently. We pay for doctors as taxpayers. So are you prepared to see your taxes go up another 20% or so to pay for them?
Would you agree, Ahmed, that society has got a wrong valuation of certain careers and certain jobs that people do?
Yeah, I would agree to an extent, yes. Again, I just really want to emphasise that we just don't feel... I mean, look at the responsibility that we have and the responsibilities. And I don't want to work as a locum consultant. I want to work as a substantive consultant.
Yes.
But the pay is considerably less. So if we do increase the pay...
Everybody talks about a mental health crisis, and there is no chance of them narrowing the gap with the mental health crisis because they're not going to invest in your profession, are they? I mean, no matter what you say, they're not going to do it.
Well, this is something I feel very passionate about, the disparity of esteem. We know that only 12% of the health budget is allocated to the provision of mental health care services. So we're trying to narrow that gap, absolutely. But that will take time and we need more resources, absolutely.
Patrick, we talk about the pay of celebrities, football players, all being paid so much more than doctors. Is it time to look at the funding model? Is the NHS done? Do we need to go private so that doctors can be paid better and it's funded differently?
Well, I would still say no, and there are advantages to the NHS funding model, the economies of scale, the width of access for people who really need care, despite whether they can afford it or not. Those are huge things to throw away. However, I do think there's a big danger in these strikes that people will get the idea, well, hang on a minute, this is because it's a monolith, that individual groups within the system, within healthcare, can effectively close it down. If we had a competitive system with 40 or 50 different providers and they were all making individual contracts with individual medical staff, then that wouldn't be a problem anymore. So I think the BMA needs to be very careful or they'll start undermining the whole ethos and reasons and public support for the NHS.